Hi there, thank you very much for tuning in today. My name is Shona Karppa and I'm going to be taking you through our chosen topic of today's webinar session, which is dementia awareness. So the learning outcomes for today is we want to discuss the condition dementia. We want to know what dementia is. We want to be able to understand the anatomy and physiology in relation to dementia. And we also want to know what signs and symptoms somebody might have if they have dementia as a condition. So first of all, what is dementia? So dementia is an overall term, what we like to call an umbrella term, that describes many different types of conditions. It's not one singular thing. So the umbrella term, as we think about it visually, we have the umbrella and we have the different types of dementia. They might have similar signs and symptoms, but they're not completely the same thing, which is very important when we go to understand dementia. So the types of dementia that we're going to be discussing today is Alzheimer's dementia. We're going to discuss vascular dementia, Lewy bodies dementia, frontal lobe dementia, also known as frontal temporal lobe dementia, and we're also going to be discussing other conditions that could relate to somebody having a dementia type condition. So the first type of dementia we're going to look at is Alzheimer's disease. So as we can see on the screen, we have two pictures. They have a picture of somebody with a healthy brain compared to an Alzheimer's disease brain, and we have a picture of a diagram of the brain and the different lobes being broken down. I want you to pay particular attention to the brain that has the healthy side of the brain and the brain with Alzheimer's disease. We want to have a look at the differences here. So we can see with the healthy brain, we can see it's a pinkish off greyish colour. We can hardly see any spaces in between the tissue mass compared to the person with the severe Alzheimer's. When we look at this, we can see a significant change in size, a change in shape, and almost a change in colour. And we can see very big spaces in between the brain tissue. So this is what we call atrophy. Atrophy is general shrinkage of brain tissue over time. So depending on this brain tissue shrinkage, where it's occurred in the brain, will result in the type of signs and symptoms that person will present. So when we look at the picture here that shows you the brain being broken down in different sections, we can see in this picture it just demonstrates the frontal lobe. So that's important to us because it gives us an intelligent, a judgment and behaviour. We have our parietal lobe at the side there, and that's in charge of our language skills. And we have our temporal lobe there, which is in charge of our memory. So according to the NHS UK website, Alzheimer's disease is the most common form of dementia diagnosed within the UK, and this was a study taken out in 2021. So Alzheimer's disease, although we've mentioned about this general shrinkage of the brain tissue all over time, which could happen generally with age as we get older, but it's also caused by a build-up of plaque deposits, proteins around brain cells. When this occurs, the brain cells start to die, and it affects the brain's ability to send chemical messages called neurotransmitters. One particular type of neurotransmitter which is found to be very low in somebody with Alzheimer's disease is acetylcholine. So like we've also mentioned there, the brain tissue can begin to shrink over time with age, as we've mentioned already. So when we look at the signs and symptoms of somebody with Alzheimer's disease, we want to break this down into three separate stages. We call early stage, middle stage, and late stage symptoms. So beginning with our early stage symptoms, we have somebody who could become quite forgetful. They could quite often forget names. They can misplace items. They could begin repeating questions quite often, and they lose a sense of themselves about their security. Moving on to middle stage symptoms, we have confusion, disorientation. The person can get lost quite often, forget what they're doing, they're often found to be wandering, and they can also get confused with the time and day as well. They can become quite obsessive, they could have repetitive behaviour and impulsive behaviour. This is when you find that the person's personality starts to change. They can also have delusions and paranoia. They believe things that are happening around them, even though that's not true. This is when people tend to start to come out with conspiracy theories, and they become quite untrusting. They don't trust the people that are around them. And they can also begin to have difficulties with speech or language. This is known as dysphagia. They could have changes in their sleep patterns. So again, if you think about if they're having confusion with daytime and nighttime, this could be a contributing factor to the change in sleeping patterns. They can also have a change in mood. as well as hallucinations, as already mentioned, with regards to the delusions and paranoia. So looking at the later stage symptoms. So this could occur in incontinence, so they could become incontinent of bladder and bowel control. They could have issues with eating or drinking. So again, this could be in relation to having their time and day mixed up. It could be in relation to their visual perception, their cognitive ability becoming quite difficult. Weight loss, again, a contributing factor if the person's not eating or drinking well. They could have issues with their long and short-term memory. And as already mentioned, a gradual loss of speech. So this is our Alzheimer's disease. We're now going to go on to talk about vascular dementia. So what is vascular dementia? So let's break down the words. We have vascular dementia. So we've already discussed that dementia is an overall term to describe a condition. So vascular dementia means vessels, blood supply around the body. So we have a picture here of the brain, and we want to bear this in mind when we're looking on to talk about vascular dementia. So what is it? So vascular dementia is when there's been a disruption of blood flow to the brain. Quite often people get a heart attack and a stroke mixed up. If you think about a heart attack for a second, what happens in a heart attack? We have a clot that's travelled to one of the vessels within the heart. It has blocked that blood supply from providing oxygenated blood from entering that heart muscle. That heart muscle starts to die. In our blood, we need oxygen. Our muscles in our body, everywhere in our body needs a good oxygen supply. If we don't have the oxygen supply, it starts to die. So you want to think about that heart attack component, and we now want to think of that in the brain. For somebody who has vascular dementia, they've had something that's happened to their brain to stop it getting the oxygenated blood. So quite often we refer to this as somebody having a stroke-related dementia, vascular dementia. So we have had a clot that has travelled up to the brain and is clotted and prevented a good source of oxygenated blood getting to that brain tissue, and that has started that brain to die off. The brain tissues are now dying off. So this is how that person could get a dementia-related condition because of that lack of good oxygen supply. This is called an ischemic stroke. Another type of stroke that you can get is called a hemorrhagic stroke. So a hemorrhagic stroke is when there's been a bleed on the brain. So it could be there's been a build-up of blood pressure behind in the small vessel that has caused that vessel to rupture. Again, a bleed. That loss of blood with the oxygen, that brain's not getting the oxygen that it needs, so the tissues will start to die off. Something else can seem to happen is if we have that build-up of blood between the brain and the cranial space, it will start to push down on the brain tissue and therefore causing damage to the brain tissue also. So as you can see in the slide here, we again have a good picture here, a visual picture of the brain and its components. The picture on the top, we have two sides of the brain. We have the right side of the brain and the left side of the brain. For somebody who has had a stroke on the right side of the brain, which is the purple part of the brain, again, this is for demonstration purposes, the brain is not this colour. So on the right side of the brain, which is the purpler side there, if somebody was to have a stroke there or a bleed in the brain, it would be the left side of the body that would be affected. If we had the left side of the brain that would have a bleed or a stroke, it would be the right side of the brain that would be affected. Again, we look at the bottom picture here where we see the view of the left side of the brain, and you can see that again it's been broken down further into the different sections of the brain. So for example, if somebody had a stroke near the front lobe of the brain there, they could have issues with their thinking. If they had a stroke or a bleed at the back of the brain or the occipital lobe, they would have issues with visual disturbances or might lose vision altogether. So again, depends on where this clot or bleed has happened will result in the types of symptoms that person can have. So again, they can vary. So we're now going to move on to Lewy bodies dementia. So what is Lewy bodies? So Lewy bodies is actually the name of the protein that has been found when they researched and discovered this form of dementia. So Lewy bodies proteins are found within certain cells, again, that damages the cell tissues from being able to communicate with each other and damages that part of the brain. So the brain cells are normally affected by these clump formations are the brain part that is involved with thinking, it's involved in muscle movement and visual perception, as we can see in the picture there below. So again, depending on the type of protein and whether it damages in the brain will result in the types of signs and symptoms that person will have. So moving on to frontal lobe dementia. So again, breaking down the name, frontal lobe. So we're thinking about the frontal lobe parts of the brain. So this is when this plaque build-up has builded up around the frontal lobe. It's also known as frontal temporal lobe because it could affect the frontal part and also times found to be in the temporal at the side part of the brain also. So again, with this type of dementia, it's a build-up of proteins that affects the nerve cells, like the other types of dementia, but it's particular type of proteins that are named after different conditions. But this one particularly is affected to the front of the brain. With this person with frontal lobe dementia, they tend to have a change in their personality and their behaviour. They can have issues with language. They could have memory problems. They're quite often to have mobility difficulties. They can have muscle weakness, difficulty swallowing, and they can also have loss of bladder or bowel control. They can also have problems with processing abilities as well. So again, with all these signs and symptoms, these are most of these issues are consistent with the type of the brain that the dementia is affecting. So we're now going to go on to talk about other causes of dementia. So other than this shrinkage of the brain, a bleed in the brain, a clot in the brain, or the protein build-up, there's other causes that could relate to somebody in having a dementia-type condition. This could be as a result of somebody who has had alcohol-related brain damage, which is a specific type of dementia. We'll go into this shortly. The person could potentially have a head injury that's damaged the brain tissue that has resulted in cognitive impairment, which again could relate to somebody having a dementia later on. Or there could be genetic related conditions also that could result in somebody having a dementia type condition also. So we're going to go into this shortly. So looking at alcohol-related brain damage. So this form of dementia is caused by a lack of thiamine in somebody's diet, thiamine deficiency. So if you think of somebody who's alcohol dependent, they usually find with the alcohol excess that they have that they affect their gastrointestinal processes in their body, and this obviously affects their ability to absorb certain nutrients. So one of these nutrients that is affected is the thiamine. The stomach, the gastrointestinal system doesn't absorb it as well as it should, and the brain needs thiamine to keep it sufficient to keep it working. With the less thiamine that's present in the bloodstream and the stomach and your food, etc., that will start to affect the brain, and it starts to affect the brain tissues, and they begin to shrink, similar to the atrophy that we discussed in the Alzheimer's. But also somebody, if they're being undernourished because they're not eating or drinking well because they are drinking consistency, this could result in them having a thiamine deficiency as well. So with the signs and symptoms of somebody having alcohol-related brain damage dementia, could be being undernourished, they are quite often confused, they could have memory loss, they could have difficulties controlling their eye movements, poor balance, and also they could have a change in personality. But this is quite difficult to distinguish, especially if they're still alcohol dependent, and alcohol can change a person's abilities and their cognitive function and their personality traits as well. So moving on to somebody with a genetic disorder, a type of condition known as Huntington's disease is a genetic chromosome that is spread through hereditary, it's spread through genetics from when we get from our parents. But this Huntington's protein can affect the brain tissue as well, and this can result in the person having involuntary movements. They can have a decline in their thinking and reasoning skills. It can also result in that person becoming quite depressed and having mood changes also. So that brings us to the end of today's webinar. But just to summarise, there are many ways that somebody with brain damage or a brain condition could result in having a form of dementia. The name or term dementia is an umbrella term. It's used to describe many types of conditions that could present in a type of dementia condition. It's important to remember that not everybody's condition will present the same, and everybody's condition can have different signs and symptoms and therefore should be treated differently. So thank you very much for listening to today's webinar. I hope you enjoyed it, and we hope to catch you again soon with another 10 to 15 minute webinar. Thank you. Bye.